Alright, so we are going to look at the glenohumeral joint, the humeral ulnar joint, the radiocarpal joint, the femoral acetabular, and the tibiofemoral. So for the shoulder, we are going to do, this is end range of motion, so you're going to bring them into flexion, and then this end feel is going to be a muscular stretch. And then we are going to do abduction, and you're going to bring them out to the side all the way up, and this is also a muscular stretch. And then extension, you bring them straight back, and this is a capsular end feel. And then for adduction, you bring it across the body, and this one is also capsular. And then internal and external rotation, you bring them out here, bend their elbow, and you stabilize here and pull them back as far as you can. This is also a capsular end field. And then for internal rotation, you go the opposite way and pull them all the way in. This is a capsular end field. And then for the elbow flexion, you will bring them all the way up as far as they can, and this is a soft tissue endpoint. And then extension, you bring them into full extension, and this is a bony block. The wrist, we have flexion, you bring them all the way up, and this is a capsular. Extension is also a capsular. And then you have pronation, pronate all the way. This is a capsular. And then supination, you pull them all the way out, and this is also capsular. And then you have ulnar deviation, you move it towards the ulnar side, and then you're stretching the, it's a ligamentous end field, stretching the RCO. And then you radial deviate, pull them to the radial side, and you're stretching the ligament, so it's a ligamentous end field, and you are stretching the UCL. And then have you lay down on your stomach. And then we're going to do the hip. Hip extension. You're going to grab the leg and pull them up as far as you can, and this is capsular. And then flip over. And then flexion, you're going to do the same thing. Keep your legs straight, bring them all the way up, and this is capsular. Abduction, you're going to keep their legs straight, bring them out as far as they can, and this is capsular. Adduction, you're going to bring the leg across the body, and this is also capsular end field. And then you swing out and sit on the edge. And then at the knee, you will, extension is it's a capsular block. And then flexion is a soft tissue block. And then stand up. And then we will do some passive, active assistive, and active range of motion. So passive for shoulder flexion is you're going to completely relax and let me do all the work. And then you just take them through the range of motion all the way up to the top. And then active assistive is you're going to help me and move your arm up with me. This is active assistive. And then active range of motion, you're going to do this yourself. So go ahead. Alright. And then grab a seat and we'll do knee flexion, or the extension. So passive knee extension will be completely relaxed, and I pull her leg all the way out into extension. And then active assistive, you're going to help me kick your leg out. So this is active assistive. And then active, you will kick your leg out as far as you can, as straight as you can. And that's active. And then dorsiflexion, we will go passive, which is completely relaxed, and I pull her into dorsiflexion. Active assistive is help me pull your foot up. This is active assistive. And then active is go ahead and do it yourself. And that's active. So now we're going to measure one of the range of motions, and I'm going to pick the knee, so the tibiofemoral, joint. So we are going to use a goniometer, and our fulcrum is going to be on the joint line. Our stationary arm is going to be following the middle of the femur, and then our moving arm will follow the middle of the leg as she kicks out. So, stop. So she has about 120 degrees of range of motion, and normal it should be about 180. So in order to fix this, we will work on her range of motion and improving it by warming up before treatment, either by biking, jogging, or using a hot pack. And then afterwards we will work on stretching the quad muscles. So go ahead and lay on your stomach. So stretching the quad muscles are just going like this and pulling her heel to her butt. And then you could stick your knee under her knee and stretch it even more. And then you could have her also do some active stretching. And then as she becomes more accustomed to that, you could add like a weight in order to improve it even more. And then at the end of each session, we will ice her for about 15 to 20 minutes to make sure she doesn't become sore and then lose that range of motion over time. All right.